I'm going to start off by performing hand hygiene. Hello, my name is Sierra, and I will be the nurse performing your assessment today. I'm going to check your armband. Okay, can you confirm your name and date of birth?
Claire Dingus, 9/17/03.
Okay, I verified the patient using 2 identifiers. Now I'm going to provide privacy by closing the door and closing the curtains. And then before we begin, I am going to perform a head-to-toe assessment. This will involve checking your mental status, eyes, ears, heart, lungs, abdomen, strength, and skin. I will explain what I am doing as I go. Please let me know if anything is uncomfortable. I've ensured proper lighting, and I've gathered my equipment. I have my stethoscope, my pen light, my watch. I've ensured proper lighting and equipment readiness. Do I have your permission to begin?
Yep.
Perfect. So patient's vital signs. We'll first get a temporal temperature. Patient's temporal temperature is 36.7 degrees Fahrenheit or Celsius. Heart rate is approximately 62 beats per minute. Blood pressure is 114/67. Respiratory rate has been 16 breaths per minute. Oxygen saturation is 100% on room air. All vital signs are within normal limits. Now, I'm going to assess the level of consciousness by observing the patient and asking questions. The patient is alert. Can you tell me your full name?
J.M. Claire Dingus,
Where are you right now?
CAMC Trailer.
What is today's date?
April 22nd, 2026.
And why are you here right now?
For an assessment.
Yes. The patient is oriented to person, place, time, and situation. I will now assess the pupils using a pen light. Just gonna have you look for the light. Perfect. And then I'm going to have you look at that whiteboard over there, and then look at my finger. Perfect. So pupils are equal, round, and reactive to light, and accommodation bilaterally. I have evaluated speech clarity and response appropriateness while the patient answered my questions. Speech is clear, appropriate, and responses are appropriate to the questions asked. Now, can you please squeeze both my hands as hard as you can? Perfect. Hand grips are strong and equal bilaterally. Now, I'm going to inspect the head and face for symmetry and overall appearance. The head is normocephalic and the face is symmetrical. Next, I'm going to be inspecting the scalp and hair distribution. Hair is evenly distributed with normal texture and no areas of thinning or hair loss. The scalp is clean, intact, and without lesions, redness, or dandruff. I'm going to inspect the eyes for redness, drainage, or abnormalities. Okay, eyes are clear with no redness or drainage. Conjunctiva are pink. Do you wear glasses or contacts?
No.
Do you have any vision problems?
No.
The patient denies vision problems. I'm going to inspect the ears for symmetry and drainage. Okay, perfect. Ears are symmetrical with no redness or drainage. Do you have any hearing difficulties? Patient denies hearing difficulties. I'm going to inspect the nose for symmetry and drainage. Perfect. Nose is midline with no drainage or deformity. I will now inspect the mouth and lips. Lips are pink and moist. Oral mucosa is pink and moist. Now I need you to open your mouth and say, ah. Perfect. Tongue is midline and the throat appears pink with no redness or swelling. Teeth are clean and intact with no obvious discoloration, lesions, or broken areas noted. I will now inspect the chest and precordium for symmetry and visible pulsations. Chest is symmetrical with no visible pulsations or abnormalities noted. We'll also inspect the neck veins for distension. Perfect. No jugular vein distension is present. I will now palpate the carotid pulses one side at a time. Okay. Carotid pulses are 2+ and equal bilaterally. I will now palpate the radial pulses bilaterally. Radial pulses are 2+ and equal bilaterally. I will now palpate the dorsalis pedis pulses and the posterior tibial pulses bilaterally. Pedal pulses are 2+ and equal bilaterally. I will now assess capillary refill in the fingers. Capillary refill is less than 3 seconds. I will inspect the extremities for edema. Perfect. No edema is present in the upper or lower extremities. Next, I will auscultate the chest. I will auscultate the aortic, pulmonic, Erb's point, tricuspid, and the mitral area. Heart rate and rhythm are regular. S1 and S2 are present with no murmurs, rubs, or gallops noted. I will inspect the chest for symmetry and observe the patient's breathing pattern and respiratory effort. Chest expansion is symmetrical. Respirations are even and unlabored with no use of accessory muscles. I will now inspect the skin and lips for color. Skin color is appropriate for ethnicity and lips are pink with no cyanosis noted. I will now auscultate the anterior lung fields bilaterally. So now I am going to listen to your lungs from the front. Please take slow, deep breaths in and out through your mouth each time I move my stethoscope. Okay. Now I will auscultate the posterior lung sounds. I'm going to listen to your lungs from the back. Please continue taking slow, deep breaths through your mouth. Okay, great job. Lung sounds are clear and equal bilaterally in all lobes. No wheezes, crackles, or bronchi are noted. Have you had any cough, shortness of breath, or chest discomfort? Okay, the patient denies cough, shortness of breath, and chest discomfort. I'm going to inspect the abdomen for contour, symmetry, and visible abnormalities. The abdomen is flat, symmetrical, and without visible masses or distension. I will now auscultate bowel sounds in all 4 quadrants before palpating. I'm going to listen to your abdomen before I touch it because palpation can change the bowel sounds. Okay, perfect. So bowel sounds are active in all 4 quadrants. Now I'm going to gently press on your abdomen. Please let me know if you feel any pain or tenderness. Any pain or tenderness? Perfect. This abdomen is soft and non-tender with no masses noted. Have you had any abdominal pain, nausea, vomiting, diarrhea, constipation, or changes in appetite?
Mm-mm.
The patient denies abdominal pain, nausea, vomiting, diarrhea, constipation, and changes in appetite. When was your last bowel movement?
Yesterday sometime.
Okay. Patient states their last bowel movement was yesterday and was normal. Have you had any pain or burning with urination?
Mm-mm.
The patient denies pain or burning with urination. Have you had any urinary frequency, urgency, incontinence, or difficulty urinating?
Mm-mm.
Patient denies urinary frequency, urgency, incontinence, or difficulty urinating. Have you noticed any blood in the urine or changes in urine color?
No.
Okay. The patient denies blood in the urine or changes in urine color. I'm going to inspect posture and overall body alignment. So I'm going to have the patient stand up, momentarily unhook them so we can do a musculoskeletal assessment. So posture is upright and body alignment is normal. So I will assess range of motion of the shoulders, elbows, wrists, hips, knees, and ankles. Please lift both arms straight up over your head, then bring them back down. Now move your arms out to the side and back down. Next, roll your shoulders forward and backward. Okay, please bend and straighten both elbows. Now turn your palms up and then down. Please bend your wrists up and down, then move them side to side. Now make circles with your wrists. Good job. While sitting or lying down, please lift one leg up at a time.
Not to sit.
You can sit.
Oh, sorry.
Perfect. Now move each leg to the side and then back in. Okay, please bend and straighten each knee. Now point your toes down, then pull them back toward you. Okay, now turn your feet inward and outward. Then make full circles with your ankles. Okay, now get back in the bed. Get back up. Range of motion is full and without pain in all extremities. Now, I'm going to have you push on me with both hands and then pull me. Perfect. Okay. So range of hand pushes and pulls are strong and equal bilaterally. And now I'm going to have you do the same thing with both feet.
You can do it all.
Sorry. Okay, so push against me and then pull back. Okay, perfect. So foot pushes and pulls are strong and equal bilaterally. Have you had any muscle pain, joint pain, weakness, or difficulty walking? Okay, the patient denies muscle pain, joint pain, weakness, and difficulty walking. Now, I've inspected the skin for overall color, temperature, moisture, and integrity. Skin color is appropriate for ethnicity. Skin is warm, dry, and intact. I've also inspected the skin for any bruising, redness, lesions, wounds, or pressure injuries. No bruising, redness, lesions, wounds, or pressure injuries are noted. I'm going to ensure the bed position is in the lowest position and that the bed is locked, which it is. I will ensure that the call light is within reach to the patient. And then I will raise the side rails as appropriate. So the bed is in the lowest locked position. The call light is within reach. And I am raising up the two upper side rails for safety. Okay, patient safety measures are in place. I will now document the assessment findings in the patient record. Thank you for cooperating. Let me do your assessment today. You did a great job.
Thank you.